Welcome back. Today I have Kathy, and she's with the Indy Lactation Care. Welcome.
Thank you.
Yes, thank
Good
you
to
for
be
joining
here.
us. What you guys missed is we were catching up off screen. Come to find out that Kathy was actually my lactation consultant in the hospital with my oldest, who's 14. And so she feels very
Crazy.
familiar to me. And
Aw.
so it's nice to see you again.
Oh, thank you. Same here.
Thank you. So I guess tell us a little bit about what you do, your business, and just kind of give us a general background.
Yeah. About 8 years ago, I left the hospital and started my own practice so that I could work in homes. We have clinic and virtual consults, but with moms so that we could practice a little bit more independently under our full scope of practice.
That's great.
And yes, and so we're able to see everything. I love being in the home. I can see the full family, the animals, the layout moms are feeding in. Newborn phase is a high stress phase for moms,
Yes,
right?
Uh-huh.
And when you can see them where they're most comfortable, not in the hospital setting where everything is just unusual to them and new, you kind of really get to see the full impact of what's going on in their feeding journey.
I love
So
that.
yeah, it helps so much. And then I've just had a phenomenal team join me over the years,
Okay.
like one every year. And the thing I love about everybody that's been hired to the team, they're compassionate, they're caring, they're great listeners. And number one, what we want from this business is my idea of a good feeding journey. It may not be yours. And what's working for you may not work for someone else. So we don't do
Absolutely.
judgment. We don't do guilt. We try to sit back and hear what the family says. And then we want that feeding experience to be what will work for the family.
I love it.
Not even what the literature says, right? Not even
Exactly.
that. We have evidence-based research.
Mhm.
We know what the healthiest form of feeding is,
Yes.
but it's not going to work perfectly for every family. So we have to be realistic.
I love that. And
Yeah.
you're going to have some working moms, some stay-at-home moms.
That's
And
right.
I'm sure I remember going back to work after my first, and I worked in ER and trying to be able to find time to pump when you didn't even
Right.
really get a lunch break. I got really good at these like
So
7-minute
hard.
pumping sessions. I was,
Yeah.
charting and trying to eat at the same time.
And that's sad. We have to do that. It's
Isn't it?
sad.
Yes,
Yeah.
I know, but it was, kind of part of it at that
Yeah.
time, which again is why it led me more of this type of, care.
Right.
Even though I'm thankful for those early ER days because it helps me so much in my practice now.
Oh, absolutely. It's a good foundation.
I think some things we love about what you do is that it's such the personalized care, and you do meet women where they're at, and that's exactly what we do through here.
Right.
So I think you're doing a great job.
Thank you.
I guess, can you give me a little about your background? You
Sure.
shared that you've been a nurse for a long time. I won't date you
Long
and tell anybody
No,
how
it's
long.
okay. Yeah, 40 years.
40
Yeah,
years.
long time.
And then you
Yeah.
got into lactation. Can you tell me a little about that?
Yeah, I came from one of the first LDRPs in the country in Kansas City. I had a phenomenal mentor. So we learned everything there, labor and delivery, NICU, postpartum. But we were already providing full lactation services. This was a long time ago, but it was
Right.
1986.
Oh my goodness.
And my mentor was a phenomenal lactation supporter. There wasn't
awesome.
much board certification back then. But I even sent her a thank you note years later because of the trajectory that she helped send me on in my career. I've just been very blessed to get to do a little bit of everything from labor and delivery to Riley to I've always done feeding support in some way because of her impact on my life.
It's amazing, those early people who mentor you.
Yes.
I have lots of nurses that did too. And we got together with a group of us a couple weeks ago, and we ended up sending her like a little Facebook thank you. Mary Ross. I mean, just was so wonderful.
I love that.
On how much she supported us when we were
Isn't
kind
that
of the baby
crazy?
nurses and,
Yeah. And you don't fully appreciate when you're in the thick of it.
No, definitely not.
You don't. And you get out, and I just think of, I've had a great career. I've been able to manage an OBGYN group and fertility group and always had a feeding business. But I look at all those experiences and then running your own business, just how all of those things were in my life to set me up for what I'm currently doing.
Absolutely.
So those experiences have been amazing.
I think that's great.
Yeah.
What are the most common issues that people come in with?
Yeah, the two leading issues that moms have concerns about are sore nipples.
Okay.
And people still teach that's normal to have ongoing painful nipples, which it is not.
No.
And I don't make enough milk. So those are the two big things. And I think with soreness, we can break down, I have soreness irritation versus I have take your breath away pain. There's no joy in feeding. They're two different things.
Absolutely.
And that there's no joy in feeding because I have so much pain is not normal. And it can never be normal for anything in our lives.
Absolutely.
Right? So I still hear that even being taught to this day. But moms will put up and put up and put up with pain a lot of times, and then they finally reach out and realize there was an answer. So that's very encouraging when we finally get that call and we can go in and say, there are some simple things we can do here to make a big difference for you.
I think that's fantastic.
Yeah. And the low milk volume.
Oh, yes.
If your baby is gaining weight well, you have enough milk.
Absolutely.
But that is, if the baby's hungry all the time, there is a reason for that. If they're constantly showing hunger cues, it may be that you're still in the really high level 8 to 12 feeds a day phase, and it may be other reasons that your baby is not, quote, satisfied or content after a feeding.
So nice you get to come in the home and actually kind of figure that out.
That's
versus,
right.
I feel like even 20 years ago, people didn't have access to that kind of care.
That's
and
exactly
you're just
right.
figuring it out as you go, right?
Right. Yeah.
Are there any common misconceptions that you're faced with besides you mentioned a little about the soreness? Anything else that?
Yeah, I think one, in talking about this is, I'm going to touch on this because it's a little more unique. But again, connected to I don't have enough milk. We are seeing a huge upswing in what we call hyperlactation. Mom's making more than what the baby actually needs. And I call it the Niagara Falls effect. So baby is basically drowning. The milk is coming out so fast, which, indicates big volume and big love hormone oxytocin. But we're finding so much out about that. It is our environment. It is the chemicals. It is gut health causing some moms not to be able to control that volume. And then another big impact is tongue tie. So it's really interesting, about 80% of moms who have babies that can't control their flow, 80% have ties.
That's very interesting.
Isn't that interesting? So our environment, our genetics all have a role in that. But again, there are answers. You don't have to put up with a baby drowning at the breast, choking, coughing, gagging, throwing up. There are answers to that.
And so do you guys evaluate for tongue tie as well?
We do. That's a big part of what we specialize in. Doesn't mean all babies need a frenectomy, but we will evaluate for 4 things: how the tongue lateralizes or moves side to side, how high it can elevate to the palate. Is there a valley or a cup in the tongue? And then does the tongue actually move side to side and elevate at the same time well? So there are different functions. Oh, and extension. That's where I was going. Extension of the tongue. So gone are the days where we put our finger in, take the finger out of the mouth and go, baby sucks. We really look at those 4 elements of a good suck to know if function is working well.
It sounds like to me, for most new moms, having you come in just to do an evaluation, even before there's a problem, would be a nice thing to have done.
That's right. So that's why we love prenatal consults. So many of our families now will reach out for a prenatal consultation, and that's basically where we can see you during your pregnancy. We do a full history. Sometimes it's interesting how often in those histories we find things out that could impact breastfeeding. Sometimes we do a visual assessment, and we do at every appointment, a visual assessment of mom's breast tissue while we're fitting them for flanges and pumps, talking about all of that. And we literally have learned now 4 different elements of breast development that can indicate low supply. But some people are never told that during their pregnancy. And then they're set up for things that make them feel bad after they have the baby if things aren't working perfectly.
That's very nice.
It is. So we could plant seeds during the pregnancy that then will help moms feel more confident and secure to reach out for more help, but also to know, hey, there may be a reason if things don't go perfectly with milk production, for example. So I think it just kind of sets moms up for the sense of success and not a sense, again, of guilt or failure if things don't go the way they expected or the textbook said.
That decreases stress there.
Absolutely.
Knowing somebody's there that you can call and say, hey, I'm having trouble.
That's right. Education is everything. It really is.
People, I guess, I know some's obvious, they're having low supply or too much. What other reasons could people reach out to you to call for support?
Well, we have some moms that want to initiate lactation that have adopted a baby. And that we see a lot of those cases, which is so fascinating. We have some families that are same-sex families, some families that have adopted and want to initiate volume. And there are definitely things that we can do. There's a protocol called the Goldfarb protocol. It's been around for many years, but again, the longer we do it, the more we learn about how hormones impact breast milk production, glandular tissue development. So that's been a big increase over the years, seeing those moms.
Wonderful.
Isn't that amazing?
Yeah, I don't even know if I really realize that was an option because I have my
Yes.
youngest is adopted.
Oh, I didn't know that.
Yeah, so he will be 5 in
Oh,
November, and we've had him since he was a brand new baby, and
oh my
he's the joy of
gosh.
our family.
Yes.
But I didn't even know that was an option,
It is an
or I would have
option,
considered that.
especially if you've breastfed before.
Yeah.
Most moms can make some level of milk. PCOS, when moms have PCOS, polycystic ovarian syndrome, they are more likely to have lower glandular tissue. So
Makes sense.
initiating a milk production in those moms is harder.
Okay.
But we do have other options as well to help them still at times put a supplemental nursing system at the breast with a tube that comes to the baby. And again, it goes back to desire of the mom and family. Not all moms want to do that, but helping them find a feeding plan that works best for them. So that is something that we do. We work with a lot of babies that have been in NICU or late preterm, that 34 to 36 and 6 weeks.
That's fantastic. Any tips for preparing for lactation prenatally?
Yeah, the biggest thing really is a prenatal consult. I love that. Okay. The other thing is about 5 years, we had this explosion of research in the lactation world. So out came new studies about mastitis and plugged ducts from the Academy of Breastfeeding Medicine. And we learned more about fitting flanges. When I knew you with your first child, we did not understand what we know today about fitting flanges.
I used them, and I remember how it's not a one size fits all.
It is not, but every pump came with what? The 27, the 24, and the 30 or 36. And so we were taught go larger, go larger, go larger. And then the study came out, and I'm like, what? And I'm a prove it to me gal, right?
Yes.
So we're measuring now, and I'm going, come on. She was in a 24 with her last child, and she's measuring a 13 millimeter nipple now. Crazy. I got to see this in action. And so we started doing it more and more. Those moms are getting more milk out. They're having less nipple pain, fewer plugged mastitis. It is so interesting to me. But, as the data is there,
the research,
we learn so much. It's just the willingness to apply it, to practice.
I love that you have been in practice so long and you're still willing to look at that new research.
Oh, I love it.
I do too. I think it's one of the things that are special about here is I'll tell people, well, what I know now.
Right.
But as I learn, if I learn more, risks, if, outweighing the benefits, we're going to discuss this.
Absolutely.
And so it's all about the medicine changes.
That's right.
There are things I thought about 2 years ago, and even down to hormones and things like that.
Absolutely.
That my opinions changed in 2 years. So it's always about reading the literature and keeping up to date.
That's right. And I have moms that I saw with their first 2 or 3 babies. And now I'm coming in with their 4th or 5th going, yeah, you're not a 24.
Yeah.
And they'll say, but you fitted me. And I did. Yeah. I did not know. And now I know.
I think that's fantastic.
It is. And that's why I love this field. It is such a new field, really. It's young. The research is just growing and growing and growing. And we love that. Our whole team really loves research, and we share with each other all the time.
How many people are in your team?
Well, we have 8. So there are 7 of us that are board certified lactation consultants. And then we also have a dietitian on staff.
Oh, that's wonderful.
Yes.
That definitely seems like it comes hand in hand.
It does. She's amazing. Plus our administrator. So and Rochelle is fantastic. She has someone else, Betsy, who's an assistant to her. So we just have a great team. We love it.
Wonderful.
Yeah.
Tell me, we can touch on feeding multiples. Let us know a little bit about how you encourage people with multiples.
I think there are so many unknowns with feeding multiples. Are they going to be healthy? Are they going to be in NICU? Are they going to be limited in how often they get to be at the breast? And I think there's a lot of misinformation with feeding multiples, just the same as singletons. Yes. So I think especially prenatals with moms that are going to have multiples are so helpful. Because I want to ask that mom, all moms, what is your desire? Right now, today, what do you think your plan is? It could change. You're not held to this. But what do you think you want? Do you want to solely, exclusively breastfeed? I'm not going to lie. That's hard. It's not that it's not doable. It's doable. But we have to make sure you have some support systems in place, that you have all the equipment you need, that we have the right pillows, that we have the right positioning for you in bed so that we get you off on the right foot. And then we'll walk the journey with you. If your baby is early, what is that going to look like? Sometimes, from working in the hospital, right? One baby may go home. The other baby may not be discharged yet. So walking with them through all of that. And number one, when in doubt, we're going to pump it out. So mom is making enough milk. When in doubt, feed the baby. Yes. You never go wrong with those 2 rules, right?
I love that.
Yeah, we got to feed a baby no matter what it looks like.
And I can tell your positivity towards the mothers would be so reassuring, saying, you know what, we're going to make sure your baby's fed.
Right.
And
Number one.
if our plan doesn't go as you thought it was going to, it's okay.
It's okay. And
Yeah.
we all carry formula in our car. We don't
Mhm.
have quick access to pasteurized human donor milk or any donor milk at an
Yes.
appointment. And if a baby is in crisis, we grab a bottle out of our car if family doesn't have one. We're going to feed that baby. And
Yes.
unfortunately, it happens on a rare occasion where we have
Mhm.
to do that. We may not even have a mom making milk yet. So we've got to give that baby protein to function.
Absolutely.
Right?
Yes.
So when we all come into it with the same thought, and it doesn't mean there won't be tears,
Mhm.
that things aren't going exactly the way we plan. When a baby has the energy to work, they're more likely to feed well at the breast or feed
Absolutely.
better.
That's a great point.
Yeah.
So now I talked a little about when I was returning to work after nursing. Do you give support for these moms of how, how are you going to pump? How are you going to, make it work in your day?
We absolutely do. And we start talking about that in the prenatal, postpartum first visit. Some moms will see 6 or 7 times postpartumly,
Yes.
depending on what their desire is.
Mhm.
But some moms will call us back right before they return to work. So we've planted seeds all along the way, but then now it's becoming reality.
That overwhelming trying
It
to figure it all
is.
out.
And unfortunately, TikTok and Instagram makes us think we have to have this massive freezer stash,
Right.
which is not true.
No.
It is not true, right? And it can cause trouble when we go into it with that mindset.
Absolutely.
And again, my body's failing me because I can't do that. No, most of us can't do that, and it's not the expectation. So that's kind of a joy for me, is getting to work with those moms frequently so we can kind of make sure they feel confident. We then work with a lot of 6-month-olds ready to introduce solids. So we do some baby-led weaning education as well.
Oh, that's fantastic.
Yeah.
Because I do have a lot of moms ask me, how do I wean?
Right.
I go back to thinking about like, what did I do? And it's, that I can remember my youngest knowing I was probably done at that point. I remember
Sure.
that sadness too that comes with it. I'm never going to nurse a baby again.
Right.
So I think all that support that you could give would be so great.
We love it. We really do love it. And by then, of course, you've bonded with that family.
Mhm.
There's a trust
Oh, my
relationship
goodness.
built. And, people reach out to us with questions and concerns in between visits. So it's
Mhm.
not one visit, we don't see you again for 3 or 4 months. There's really a camaraderie, a respect, a trust relationship. And that's one thing I value in our team, is that the team really is genuinely concerned about that
Yes.
mom and that family. I think all of us now have training in postpartum support as far as emotional health goes.
That's wonderful.
It is. We've all taken the Bertie Meyer courses. And so we know how prevalent it is for dads to have some postpartum depression
I
as
love that you're touching on
well.
that. That's so important.
It is so critical.
Yes.
And so moms do get a lot of the attention in that
Mhm.
time period. And we try very hard to turn to dad and say, let's hear how you're doing when they're in
Absolutely.
attendance. And most men today are very honest with their feelings
Mhm.
and how they're feeling. They're exhausted. Exhaustion can come from overwhelm,
Yes.
right? Yes, lack
Absolutely.
of sleep, but I don't ever feel caught up. And you're the first person that's asked me that question. So our culture can do better at that.
Yes.
And while dad's not breastfeeding, he may be supporting mom with the bottle early on if mom's exhausted and emotionally struggling
Mhm.
with depression or anxiety.
I think it's so important because a lot of people don't talk about that. And I remember years ago had a friend who had a baby and he was just like, the baby doesn't really do anything. She's nursing, so I don't have her attention anymore.
Right.
It is big for these dads. So I
It
think that's
is.
great to have that support as well.
It so is. And I have a dad that I've been working with the family. The little one had some medical complications, but dad was he is the most doting person,
Aw.
asking mom tough questions so that they'll keep lines of communication open.
Yes.
He does that when I'm there working with the family.
Mhm.
And I mean, I'd love to get him on video because
Right.
he is to be praised for what he is doing. Our dads today are such amazing support systems. Now, from my era, I was fortunate. I had a husband. I worked outside the home. He was
Mhm.
not just a helper. He was doing the same work I was
A
doing in a
partner
lot
in
of
it.
respects. Yeah.
Yes. Uh-huh.
So I see so much of that today, but this guy was so amazing in that he was communicating to his wife what his struggles were. She was supporting him. And then he was saying, it's okay if you feel that way. So it was amazing. I just loved working with that couple because they were just such a great example of wonderful communication when the emotions are tough.
Yeah, you don't hear that very often.
No,
Yeah,
you
and I do.
don't.
And I take care of a lot of couples, and there's those frustrations that will come. And, it's down to this baby time, but then that's, when they leave too.
It
It's
is.
always evolving. So that communication is so important
It
to have
is.
early on.
And our culture can do better. Our country can do better
Oh my
in
goodness,
time
yeah.
off for moms. And,
And for dads.
and dads, that's what I was going to say. And so the mom's big statement to
Mm-hmm.
me is, my husband's got to go back in 2 weeks. That's often when we have another consult,
Yes.
is when dad goes back to work. Because you do feel, especially if they're in a family support system in the area,
Mm-hmm.
you feel connected often to our team, our lactation
Yes.
team. And then we are people that can be in your home a lot of times and be that person of comfort that can say, yes, they're back, but here's how we're going to cope. And here's how you're going to set your feeding station up to
Mm-hmm.
feel more comfortable for you, where you still have your snacks, you still
Yes.
have your fluids to drink, which will nourish mom's body, so they
Mm-hmm.
can then be the person providing the nourishment to their baby. We forget ourselves so often when we are taking care of a baby.
Oh, for sure.
And moms deserve that. They
Mm-hmm.
deserve that support. Not all moms have that
And
with where they live.
I can remember, after my first, you have people around, it's really exciting. You have a baby and they're, seeing the baby, but then those people all go away.
Right.
Back to normal.
Right.
And I can remember it can feel
Yeah.
very lonely.
It does feel lonely.
I said to my one friend, I was like, Anissa, I'm so lonely. And she said, you've only been by yourself for like 24 hours. You're fine.
Yeah.
And I was like, you're right.
It's true. And especially if you work outside your home,
Mm-hmm.
mommy working is full time. That is
Absolutely.
a job.
Yes.
But it is different when you've worked outside of your home to then be in your home when a baby is sleeping. And what does this look like for me?
Absolutely.
How do I cope with this? I was that way,
Mm-hmm.
type A on the go. Oh, I need to slow down.
It is, yeah, that slowing down is hard.
It's hard. It's almost another guilt driver
Mm-hmm.
for a lot of us. And so that is a new world for a lot of our moms to work through, and not feel guilty, find out who they are in those
Mm-hmm.
quiet times. What does that
Yes.
mean? Well, it's okay to take a nap. I had to have
Right.
somebody give me permission to take a nap.
Oh, I was the same way.
I
Yeah.
believe it.
Mm-hmm.
I believe it. Doesn't that say a lot about us?
I know.
It
I
really
know.
does.
Business
But-
owners, it's yeah.
And I often say to moms, don't be like me. Okay.
Right.
Just heed what I'm telling you, because, again, I think we see elements of anxiety in different ways in the home. One is that I'm already feeling guilty because I don't know what to do with me. I'm already worrying about going back to work. One thing I find is, I was talking about having the place they set up to breastfeed.
I think that's great.
It's great. And then I say, and don't get stuck there.
Right. You are 100%.
Don't get stuck there. When moms, every appointment I do is in a mom's nursery.
Okay.
I'll say, okay, do you always breastfeed here? Yes. We've got to change that. We've got to, again, normalize breastfeeding. What's that going to look like? You need to get out of this room.
Mm-hmm.
You need to go for a walk. You need to go to the fashion mall, do an ad for the fashion mall. Great place to take a baby. You can walk around. Great places to breastfeed. Great places to change diapers. Do something that's visually stimulating for you, where you can have snacks, breastfeed. We can teach you how to breastfeed in public, that still you feel confident and not worried about what people might see.
I'm sorry.
No, go ahead.
Do you ever do group at all?
We don't do as much group as what we used to. We do offer group classes. Most people want virtual classes, so we do that more. We also have a partnership with a midwifery group called Emerald Midwifery. I don't know if you're familiar with them. And so 2 of our lactation consultants do education there as well in person. But we do more virtual education. Yeah, it's very interesting. Yeah, it's changed a lot. It's
a
crazy.
lot. I used to think that I couldn't see somebody with abdominal pain, over a virtual.
Right.
But it's amazing the things that we can do now.
Absolutely.
And it's better for families. And it's easier for them.
It's better for me. I love it. I love it. And then, one of the statements, of course, that I went through said, blue and green should often be seen. So we stay inside so much when we have a newborn.
Yes.
And we know it's hot out there or it's too cold out there. Babies love being outside. They love being outside. So getting outside, that green, that blue, looking around, breathing in fresh air, right?
I love that. Yeah.
It is so important. Grounding is so important, and we can do it. Yes. But sometimes we have to remind moms and dads, have you been outside? No. Why not? Well, baby can go out with you.
Absolutely.
They will be fine. They will be safe. But we do get stuck, and we need that little gentle push to make the change. And it's stimulating
for the babies.
Babies love it.
Yes. And everything is new for them. I remember
is.
A friend kind of gave me permission at one point where I said, I just feel so bad because I'm working, and then you want to see a friend. And she was like, just take him.
Right.
it's all new for them. Them sitting down, eating lunch and playing with different things.
Yeah.
And, it's all just stimulating and it's good for them too. And it's new and fun.
Yes, they love it. And when we go into a home of a fussy baby where moms and dads have dark circles under their eyes,
Yes.
they're like, I'm never going to sleep again. This baby cries all the time. And I will say, colic is a symptom. There are reasons for it.
Yes, we
We
treat
can
that
figure
quite
it
a
out,
bit.
right? We
Yes.
can figure it out. It's often revolved around feeding, right? But if we can get that baby outside in one of those fussy periods, it's amazing how they
much
will
changes.
calm.
Oh, I love it. My wheels are turning
Yeah.
on some patients I already have that might
Yes.
benefit to see you. Any success stories that you have that are kind of close to your heart?
Yeah, one, I was reading that question, and again, back to late preterm babies, and I'll use the name because she does not care. We've talked about this before, but my sweet baby Caroline. This little one was 36 weeks, so late preterm, not full-time term, not NICU,
Yes.
preemie. But those kids come out with special needs of their own, and we don't talk about that enough. We have a course on late preterm babies online, and I tell you, it is, to me, it's worth its weight in gold, wealth and gold, because we still have many babies discharged from the hospital that are late preterm, never told they're late preterm, never educated about what that means. And what that means for babies that are late preterm, they don't have what we call brown fat to break down for calories. They often have blood sugar issues in the hospital. They have temperature control issues. They have higher bilirubin issues, right? If they are good in the hospital, many families are never taught about that. But sweet baby Caroline, she struggled from day one. She was 36 weeks. She was losing weight. She had a tongue tie. It was very tight. Mom had history of polycystic ovarian syndrome. So I was concerned she may not make enough milk. And we were on a very odd trajectory there where we're fighting to get mom's milk up. And we're working with a baby that could not suck correctly, could not function correctly, ended up having to have a frenectomy. Well, on top of having this little procedure done, we had to teach function.
Yes.
Often we do frenectomy and those babies are better immediately. And some babies, especially if they are immature at birth, they need more function work. So little sweet Caroline just graduated at almost 12 weeks, almost 3 months. She doesn't need lactation or feeding support anymore at all.
Fantastic.
And I'll say, I was concerned. Is this baby going to be able to learn function? And she did. But it was a wonderful journey getting to know this family and walk beside them. And honestly, fight some of mainstream healthcare. I hate to say it, and I said it to the family. Sometimes we're fighting things that are not accurate feeding information out there, and people mean well, but if they get an hour of education on nutrition in medical school, that includes breastfeeding, formula feeding, and there's no
100%.
function work being taught. So
it is unfortunate. We don't know.
We don't.
And so that's why I love that we have these specialties that we can send it over to you.
Right.
Because I can give some general advice. I breastfed 3 babies, but I was winging it as I went. So it's nice to know that we can give you a call and have you see some of our babies.
Right, and vice versa, right?
Yeah.
And that's why I refer people to your team all the time or other specialists, chiropractors, myofascial therapists, because we are not trained in all of that. And we need to know our scope and live within it. And we work really hard at that.
Yes. And side note, pelvic floor therapy.
Oh, love! I should have said that.
I say yes. That's a great.
We do.
Yes,
we
got some fantastic pelvic floor therapists that are awesome.
Absolutely, well said.
Yes. So I guess tell me about. Do you have packages? Do they, when they call you, do they sign up for a package? They kind of pay as they go. What is your structure look like?
Yeah, we do have packages. And we've had big changes just in the past few months. We're still navigating. So we used to have about 80% of our moms had insurance coverage for lactation visits. That's changed pretty dramatically recently. We're working on that right now. But I would say 20% of our families have insurance coverage now. Unfortunate, but true. So we do have packages if it is a difficulty financially that can offset some of the expense. Being seen in our clinic is less expensive than a home visit. Virtually is less expensive as well. We do in our clinic have the opportunity to see more moms that have Medicaid or Medicaid WIC, and we offer an extremely discounted rate for those families. We want people to get care. We want them to get care. So if they tell us they financially cannot afford our visits, we work with them in any way that we can.
I think that's awesome.
Yeah, yeah, we
We
are
try to
very
meet
fortunate.
patients where they're at as well.
Right,
If somebody loses
yeah,
a job, we try to be as generous as we can and
exactly.
extend their care a little bit longer where we can.
Right, we do what we can for
Yes.
sure.
I like that. Let me see. How can listeners access your services?
Sure. So our website's amazing. So it's indylactationcare.com.
Okay, we'll have that in the comments.
Yeah, so we'll give you our phone number and our website there, but you can self-schedule there, consult with us. We have a map that breaks down mainly the areas we cover. If you don't see anybody that covers your area, still reach out online or with our phone number there, and Rochelle, our administrator, will help find someone for you or the best fit for you. We now are covering most of Indianapolis, surrounding areas, and we even have a new group out in Lebanon, Lafayette area.
That's wonderful.
Yeah, we love it.
Let's say, we'll just kind of do like a live, question and answer here.
Sure.
It's one myth about breastfeeding you wish would go away.
I think probably the pain situation is the biggest myth. And again, I think what's sad is it's still being taught by medical professionals. Yeah. So that needs to go away. And I think the newer things are what's happening on TikTok.
Yes.
Right. People, again, mean well. Yeah. They mean well. But the overflowing freezer is not truth for most of us. I mean, even some of the things that we would say are evidence-based, research and lactation, they may not apply to you. Not everything in evidence applies to me physically.
How much do you tell your patients, your clients, to be able to have stored, maybe before going back to work?
I like them to have, and not that they need it, because when you go to work, you're going to be pumping and resupplying what's in your freezer, right? But I usually say 2 weeks supply. And this is just nice if there's an emergency, right? Mom has to be separated from baby. There is that backup. And then in that time frame, we know mom might be stressed if she's ill or baby's ill. So it's nice to have that backup. And then we work at keeping mom's milk up. But I think that gives confidence. I just would rather see posting online the 2-week supply as compared to a freezer in the garage
having
full.
An extra freezer.
Yes.
I can remember before I started nursing, I thought that I needed an extra freezer.
Right.
We ended up not needing it or getting it.
Good.
That happens too. It's, electricity goes out.
Oh, it's the worst.
It is the worst.
I know.
So I did like having those, few days where I felt confident. If you have to have a surgery last minute that you weren't
and it happens,
for, right? I liked that reason. Plus, my kids, I feel like most of them were born in the winter. So I don't know if I was going to get stuck at work an extra day or if it's going to happen.
That's right. And there's a lot of upper respiratory illness that goes on. And if babies are stuffy through their nose, they don't always breastfeed great. Sometimes the bottle, not always, but sometimes the bottle becomes a little bit easier for them if they have upper respiratory congestion. So having that little bit of extra can get babies through illness as well. Still using your human milk, because that's where all those good antibodies are to fight the infection when we have it.
I think that's great.
Yeah.
Do you have a favorite moment when working with a new family?
I think what I love is getting to see how old I am again. People stopping me in public is phenomenal and saying, this is my 20-year-old.
Yes,
this is my 25-year-old. It's pretty amazing to be in practice or working with moms and babies for so long. That is such an awesome, joyful time for me.
I love it.
Yes. But also during those moments, having the realization of how much you've changed in your practice, what you've learned, and gosh, I just hope that I taught them well back then, because you know how much you've changed. So those are precious times to me. They're such joy-giving times to know, I've had a really awesome career.
When you think about what you meant to me, and you didn't realize that we had met back then.
Well,
and that's such a big part of my life.
Isn't that
my
funny?
son, he's now 6 feet tall.
Isn't that
so
amazing?
That'd be, 14 years
yeah,
old.
That is an honor to me. It really is.
Yeah.
It is.
Oh, anything else that we haven't touched on that you want to talk about?
I think the big thing for our team is, again, care, listening well, because we miss things. And one thing I really value in our team is that they have all of those qualities, and they know, again, that their original plan when they walk in the door may change vastly as they get to know the family.
Well, you're meeting them where they're at.
Right.
What do they want to do?
Right.
What does breastfeeding look like to them, and how does it actually work in their family? I think it's so important.
It is. And sometimes what I walk in and immediately think on the notes they've sent me, I already know what's going on. I'm wrong.
Yeah, same.
Yeah.
We do the same thing.
Yeah. So I have to stop and listen.
Yeah. Well, you guys, if you're planning on getting pregnant, planning to breastfeed, I highly recommend that you check out Kathy and her team, because you did an awesome job with me 14 years ago. I can't imagine what else you've learned since then.
So much. I appreciate it.
Yeah. Thanks, guys.
Thank you.